มี 2C กรดไขมันดีย่อยและดูดซึมง่าย
Future of Functional Medicine Symposium. We will begin with the topic of understanding the effect of kissing disease, EBV, now and treatment for the future by Dr. Ursula Jakob, medical doctor and scientist in preventative medicine, here from Munich, Germany. Please welcome Dr. Ursula.
Thank you. Thank you very much. I think everybody can understand me, right? I only have to see how I can start with the first slide. Okay. Now I'm obviously sorry. How I come back to the beginning? I have to go back to the beginning. I think there. I have it. Yes, I think I have it. Okay, when we talk about kissing disease, it does not sound very bad, but knowing that Epstein-Barr virus is a virus what can cause diseases like autoimmune diseases, cancer, it's involved in a lot of neurodegenerative diseases as well. And lately, it came up in research and as well in studies because coronavirus or any kind of post-COVID syndromes, they show that in 60 to 70% of the cases with post-COVID, Epstein-Barr is reactivated. What makes a kind of sense because Epstein-Barr virus is the virus of the immune system. Because it's a virus of the immune system, and it lives in our immune cells. And we have, when we start to talk about Epstein-Barr virus, we have to keep in our mind that the immune system is the biggest organ system in our body, and it is all over the body. It looks like a spider net, a very high, dense spider net, what is in all functionable organs very dense, like the first defense from outside to inside, the mouth, sinuses, head and neck area, bronchial system, but also down there is also very high density of these immune cells. And like a spider net, as I told before, it's all over the skin, and metabolic active organs, or organs what we need for reproduction, like ovaries, prostate, uterus, all of that, breast, is very high dense in these immune cells where Epstein-Barr is living. Epstein-Barr is living mainly in the B part of the immune cells, and I think most of you know that we have two big parts of our immune cells. This is the B cells, what is a kind where we are born with, and they are like the managers of our immune system. They are like generals, when we want to speak in army form, what are controlling the soldiers, which are more or less the T cells of our immune system. And then we have the group of natural killer cells, what you heard already about. And all of these groups, they have to play with each other, and they have to control and talk to each other. Epstein-Barr is living in the B cells, means we are born with this virus. And this makes it not easy, to diagnose this kind of virus in a stage where we say it's latent, it's there, it can make problems, but it's not that you can detect it easily over the blood or saliva. And we have to know that Epstein-Barr, when it comes to kissing disease, it goes as an active form into the saliva or the blood, where we then can detect it and treat it in a way with the common antiviral therapies which we have on the market. But the most of the problems we are facing with Epstein-Barr nowadays, and which will probably, driven through Corona, come more into the future, is when Epstein-Barr is latent, chronic, active in the B cells. And there the problem starts, that we cannot detect it very easily. And when we look at Epstein-Barr, first it was too fast, now it's not going. When we look at Epstein-Barr, and this is what I told, that there is other triggers like virus, obviously, but Epstein-Barr, don't forget, is connected, it's called herpes 4 virus, it's connected to the other herpes viruses what are living in nerves, brain, or other body systems in our cells as well. And through leaving their traces in our cells and in our genetic material, they can make for now damages, and they can make as well some damages for the future. And this is called epigenetic regulation, what we heard as well and what we will hear as well during the afternoon. And the traces, what they leave more or less in our cells, is called microRNA. And these microRNAs of viruses, mainly Epstein-Barr, has the ability to push inflammatory processes, what is at the end of the day as well logical, because if a B cell, which is a defense cell, what shall develop memory, is working, it has a lot of proteins and receptors on the surface, and if these are mutated through virus activity or through other things, the problem is that inflammation as an immune answer is coming up. And when we look at our human body, we have beside the viruses others, bacteria, good kind of funguses, gut bacteria, and they should live in your homeostasis. And if one of that gets a little messed up, the others unfortunately can overgrow and can support the problems what Epstein-Barr is doing. So with the virus, if we have it, a virus from outside, when it comes in, it gets seen by the immune system normally and gets then fighted and killed. But what happens with Epstein-Barr? Because it lives in our cells. So when it comes out and the virus has the ability to go and overcome specific defense mechanisms, so the immune system is not realizing it as an enemy. So it can make damages without control of the immune system. And these kind of damages can lead to a problem with chronic infection then at the end of the day, and continuous replication of the virus. It stays quiet up to a specific point where it gets reactivated, and then slowly but constantly it makes problems. And when the patient have the first symptoms, like let's give an example in an autoimmune patient with rheuma, when the arthritis symptoms coming up, when the swelling's coming up, and this is like viral based, what is in research shown that a lot of these autoimmune diseases comes through Epstein-Barr, or lately they discovered multiple sclerosis, or a kind of other autoimmune diseases. Hashimoto is known, morbus Crohn is an autoimmune disease, what is related to Epstein-Barr. What makes sense, because the highest density of our immune cells we have in the biggest organs, what are the bowels and what are the skin. So in this stage where it is sneaky and tricks our immune system, there it gets dangerous. So the thing is, and I took this slide from a work what I was doing. I was interested in Epstein-Barr, and I'm very hysterical with this virus because I had cancer by myself, and the most trigger of Epstein-Barr, what was in the cancer cells seen and what was in my blood seen, is Epstein-Barr virus, or was Epstein-Barr virus. So for my own sake, I looked a little more up at this virus. And the problem is when you look into research, or when you look where we are standing in the diagnostics or in the kind of therapeutic tools for this kind of virus, we stuck. Because as said before, the virus lives in our cells, and the therapeutic tools, like antibodies, all of you know what an antibody is, it blocks a specific pathway in blocking inflammation over specific pathways. And if an antibody destroys, you destroy the host cell as well. So you cannot destroy, obviously, all of the B cells. It's not possible. This is a little problem. Then you cannot passively vaccinate. So there's a lot of trials with passive vaccination against Epstein-Barr, what does not work, because the virus is going back, hide in the cells with his protection mechanisms, so you cannot get it seen for the immune system. So I started to collaborate, since I'm coming from cancer, and I worked a lot with antibodies, with a pharmacy who invented trifunctional antibodies. Do you know what trifunctional antibodies are? These are antibodies like in a big opposite to the monoclonal antibodies. They are targeting a cancer cell, but they have, for the other two functions more or less, binding immune cells, and through that you get an immune answer on the cancer. So I looked for, was going to this company and said, look, could we not use for the detection of Epstein-Barr in the B cells some of our specific diagnostics, and for treating patients who have a smoldering chronic inflammatory problem with Epstein-Barr, taking the immune cells of the patients and bind it on this antibody, what is anyway on the market, and what we know exactly how it's functioning. So we were developing first a kind of diagnostic, how to look into the cells, and I don't want to bore you with the exactly, let's say, how you do it, how you isolate it. Principally, I try to explain it easy. Epstein-Barr is a virus, what if you see 2 million B cells, probably it's in 1 or 2 inside, but not active. So means the immune system of these patients has it under control. So when we isolate immune cells, and we isolate like 250 to 300 of the B cells, and we find there that in around already 10% or more, and we find it in the chronic ill patients more than 10% occupation of the B cells, then it's quite a high number. And to detect these, you make a normal, or with a what I call a normal immune assay, you separate the immune cells, and then you take in the, let's say, pure B cell population, you put GP350 in. GP350 is a virus. This is how we prepare it. GP350 is a little protein of Epstein-Barr virus, what you use to mark B cells or to find Epstein-Barr in the cells. So you mark it you bring it together with the B cells, and then you isolate the good from the bad cells. Very easily said. And this is prescribed in that, so when you want to read, you can read later about that, but it's a little bit boring how you do this all. And the first hint that something could be wrong with this patient, beside that logically we hear what the patient is telling us, so I make a long anamnesis asking the patient as well what is important in Epstein-Barr recurrence, if he had before puberty any kind of chronic infections. Because if you have before puberty, like chronic tonsillitis, using a lot of antibiotics, or using a lot of antibiotics because of ear infections, throat infections, then the immune system, what is still in development, cannot develop, and the B cells getting weaker in knowing that Epstein-Barr sometimes is not a good friend, it's an enemy. And this is always the first hint that something could be wrong. The second hint is if we find EBNA-positive EGG or a hint that the Epstein-Barr virus could be in the cells, is another hint that we say, okay, now we have to do the specific B cell symptomatic, or if you find Epstein-Barr in the saliva, it's a very easy method to detect Epstein-Barr in the saliva as well, if it's not only acute. You also can detect nowadays a specific amount of Epstein-Barr in the saliva, what already leads you to the idea that it's a chronic problem. And as you can see, the measurements of different parts of Epstein-Barr is in a lot of cancer also involved, and this is where first we know Epstein-Barr can trigger its lymphoma, specific kind of, it's called Burkitt lymphoma, and non-Hodgkin lymphoma, leukemia, they can be involved, that Epstein-Barr is triggering it. And lately, 2018, this was published, they brought a big study that not only in a lot of autoimmune diseases Epstein-Barr is involved, it's also involved in diseases like gastric cancer, pancreatic cancer, rectal cancer. So they could found that Epstein-Barr is triggering through the change of the B cells and the mutations of the receptors of these cells, and can transform cells into cancer cells. Before I come to, no, I have to come to this slide, because what I want to show is, this is what I was talking about. Look, we start to isolate from blood of the patient the Epstein-Barr infected B cells. So this therapeutic principle is quite new. It's not new for us, because since 2013 we're not only doing the diagnostics in isolating these cells, we're also doing this kind of active immunization. Because the idea, as I told you before, is how we can treat this virus without killing the host cells, and in a way that not only for now, also for later, the patient has a benefit out of this therapy. So when we have and isolated over specific cell markers, what everybody knows nowadays, which cell has specific markers, what also is used in the, at the end of the day, in the diagnostic of microtumor cells to isolate the cancer cells. You can isolate B cells, and then when you incubate them, as I told you before, with the GB350 protein, we can take the, let's say, the population of Epstein-Barr infected cells, and this scheme is used since 2001 in cancer. And it's used in all kind of cancers where these trifunctional antibodies are working. So what is the trick in this therapy is when you have isolated the B cells, and when you look at the immune system, and this is what I see mainly in, I would say 90% of the patients who have a chronic problem with Epstein-Barr, when you look at the groups and subgroups and differentiation of the B cells, you know, we have the general amount of the B cells, and then we have the part of the B cells, what are the parts, what can develop a long-term memory against viruses or a long-term memory against any kind of bacteria, and these cells are always depleted. Also the general amount of the B cells in the normal range is always more to the low side. And the T cells are still in a kind of a normal range. Killer cells are also to the low sides, because logically the immune system realized in a way that there is an enemy there it should fight it, but it not really get this enemy because it's hidden. So what we're doing in a second step is that when we have the patient there and to organize your immune cells and to train them against their own cells at the end of the day, we have to show them the enemy. So what we're doing, we are isolating a part of the T cells over these markers, and we're isolating a part of the dendritic cells, and you know dendritic cells are the ones who can build up memory cells over other proteins on the surface. What was in cancer not done like that? And these two cell fractions we bring together and let activate themselves, and we know exactly what kind of pathways and what kind of activators they need to activate themselves. This is written here. This is knowledge already from years ago when these companies started to do the trifunctional antibodies in cancer. And through that, they are, to make it easy, they are sitting in their vial and then they are waiting to do something. Then, in the same day, because we need active immune cells for this process, in the same day, we have in a different vial the infected B cells together with a 0.01 microgram of this little protein, what is nothing else than an immune enhancer in our therapy, what binds these Epstein-Barr infected B cells on this little arm to get the information about these cells. So in a second step, then we bring these, let's say the healthy immune cells together with the bad guys, and they bind over these other arms of the trifunctional antibody, and then they get immediately the information only about these cells. So in the moment you bring them together, it's an active immunization where you activate the patient's own immune cells to see the enemy. And when you give it back, it's like a little bomb what you are activating. So it directly starts in the moment you give it under the skin of the patient over the lymph system. And then we were thinking, okay, how you can prove that it's working. Besides that, you check later the rate of occupation of the B cells and the immune status. We saw that specific cytokines all the time, the same cytokines are up, what shows chronic inflammation, because, as I taught before the virus making symptoms, we have a problem that already the immune system is not detecting them. So we check the immune cells, we check a red spot at the place where you give the therapy in, and we are checking T cells, natural killer cells and subgroups the day after, what is not 24 hours later, it's only 12 to 13 hours later. And we see that the T cells, the specific ones, clearly need to decrease, the natural killer cells as well, because this shows that we activate the immune system to fight it, and after 3 to 4 months, we see in the patients then as a control that the B cells are free of these virus. And as a reaction, the chronic inflammatory cytokines from the blood, what we are checking, are much better. And this is a method where you work with the immune system. It is a method where you use the patient's own cells, and it's since 2013 we collected data. We have now a follow-up, and we do the follow-up every 4 months for every patient, checking cytokines, immune system. Then in rheuma patients, logically, we're checking the rheuma-specific issues. In diabetes, we're checking the diabetic-specific issues, and we see that the disease is getting better. Or we have CLL patients, chronic lymphatic leukemia, you know it's a precursor, and chronic lymphatic leukemia is very often driven through Epstein-Barr, and we see that I get red, I see that the lymphocytes are getting down and the CLL is getting less active. So with the therapy made from the blood-owned cells without any side effects for the patients, a little bit of fever, but that's it. We never saw other side effects. And very well staged, since 2013, we could show that we can treat Epstein-Barr. So there is an option to treat it, and very easy option, but you need the right tool for it. Unfortunately now, I have to stop, so only very fast. This is the kind of easy diagnostic what we have. The colors are not so good, so we can see how many percentage of the immune cells are infiltrated, and we can see how active and aggressive is the virus behaving. And one last word. The patients I see after corona infections, sometimes also after the microRNA vaccines against corona, they show the same, by the way, is that in opposite to the patients who have only a chronic B-cell infiltration, after corona, the aggressivity and the activity of Epstein-Barr is increasingly high. So the numbers of the measurement, or the pure GP350 cells, what we see here, it's extremely high, and I never saw it before corona. Means the virus, as a reactivation after corona, has a very I know, has a very high influence. Unfortunately, I cannot show you the rest, but you can see it in the slides, because this, I want to show something about epigenetics, influence of microRNA of Epstein-Barr for the future diseases, how you can detect that and treat it. But unfortunately, I'm finished now. So I hope I could show you that at the end of the day, we can, with the help of our own cells, target them and learn them and educate them to treat viruses, what really for later can make a lot of complications up to cancer. Thank you very much for listening to me. Thank you.
Thank you so much, Dr. Ursula. Up next is How Biohacking Your Hormones Contributes to Longevity by Mr. Varit Taifayongvichit, Managing Director of Miskoan Health Group here from Bangkok, Thailand. Please welcome Mr. Varit to the stage.
All right, good afternoon, everyone. So my topic today will be on biohacking in practice, and it'll be a layman's version. So by show of hands, could I see how many people in here are not medical doctors or scientists? Good, because I am not one either. So let's, first of all, I'll try to get this to work. There. So who am I? I'm not a doctor, I'm not a scientist. I studied pre-med in the US, and at that time I was studying to become a brain surgeon, and I did my training with Dr. Charlie Teo in Australia, who is part of our medical advisory board as well. And he's the one who introduced me to David Boehm in May 2017, and from that point on, both of us have just been investing our lives into building and progressing Miskoan Health Group. So that is my background. I'm not a scientific person. I do have a little bit of basic studies in the field, and today I'll be speaking with you guys about biohacking. I know we touched upon this topic before in the morning already. So why biohacking? Since the start of the early 2000s, there has been a hype of movement called biohacking. And it has only caught on quite recently in the last 5 to 10 years, especially in Los Angeles, where people are talking a lot about how to biohack their body. So there are multiple books that have come out, as well as videos, gyms, people trying to cheat or trying to do things to hack their own body. So what is biohacking? I had a chance to be interviewed last year by a magazine called Prestige, and part of it is mainly about lifestyle and just personality. And a big part of that article, I talked about biohacking because it's something I wanted to take on as my journey. And with that, my definition of biohacking is manipulating our external factors to enhance our biological self. It's about using our knowledge in biology to defy the normal aging process. So that's how I define biohacking. And to add a little bit more to that, I will read out a few more definitions of biohacking that I found on Google. So I can't see this too well. I'm going to move over. Hello. Okay, so one definition is human augmentation or human enhancement. And the other one is it's a way to change your body, your health, your brain so that you can reach your goals and achieve a peak state of mind. And the next one is somebody who uses science and technology to make his or her body function better and more efficiently. And lastly, this is by a famous biohacker in the US. They say biohacking is the art and science of changing the environment around you and inside you so you have more control over your own biology. So now that we know a little bit about what biohacking is, today I'll be sharing with you my own personal journey as a layman trying to go through biohacking myself. So it's about my attempts to improve the condition of the body and the mind, and there are various ways that we can do that, whether it's through technologies, through drugs, through chemicals, supplements, hormones, or the environment around us, our habits, our sleep, and the timing in which we do each of those things. So knowing that we have Miss Go On Health Group and the doctors in our resource pool, I'm lucky enough to be able to utilize our doctors' knowledge to help me and design my biohacking journey. So I'll be sharing with you, and we're going to start with the 4 basics. So first, and the most important thing that will probably have the highest impact on your biohacking is the food. So because you are what you eat. And at the start of my journey, I did a blood test with one of our doctors at Miss Go On, and I was able to find all the food intolerances that I had, as well as what kind of food that I should be taking. So from that on, I had my personalized diet plan, along with the knowledge that doctors gave me on what I should be eating and what I should not be eating. As well as at that time, I was trying to exercise more regularly. So then we calculated the amount of energy I'm using versus the amount of energy I should be taking in. So with the food, it's about calorie intake, it's about eating the right foods, and as Dr. Patana also mentioned this morning, eating colorful foods, getting low sugar diet, and intermittent fasting. So that's the first basic about biohacking. Secondly, sleep is very important. So now in this day and age, we live in a world full of lights, LEDs, blue lights, so the world doesn't get dark. If we go back to our ancestors, in the past we didn't have lights like this, no artificial lights, so we would go to bed when it's dark and wake up when sun rises again, right? But in this day and age, we don't have that luxury anymore because it's always light. And so if we were letting our own body act the way it's designed to, we would be going to bed when it's dark, wake up again when it's light. So, and today we have to sleep in a room that is dark. So what I do is make the curtains in my room extremely dark. I block out all the lights. In the morning, I'll set a timer for it to open so that my body gets in a routine. Sleeping in a dark room also helps your body produce more melatonin so you can sleep more deeply as well. Sleeping in a cool bedroom also helps. As your body's getting ready to sleep, your core temperature automatically drops. So getting your bedroom to be cooler will help you go to bed faster and deeper as well. If you know American football, Tom Brady, one of the greatest American football players in the world, he sleeps at a temperature of around 18 degrees Celsius. And I also do no heavy exercise before bed because that could raise your core temperature, and that is not so good for you right before bed. Also no distractions, so televisions, electronics, those things you should not keep close to you when you go to bed with all the signals that will disturb you, as well as the blue lights coming from your screen that will disturb the melatonin production as well. And simple things like air purifier or negative ion generator can help the atmosphere in your bedroom to be better. And third is I use supplements. So obviously I'm not able to take all the foods that I'm supposed to, so we rely on supplements. I took some screenshots if you're interested, you can see more on our Miss One Health social media as well. Dr. Jimmy is the one who helps advises me on what supplements I should be taking, and the results come from my blood test. So he'll go through each of the supplements that are personalized for me, as well as supplements that are overall good for everybody. And some examples of the supplements that I'm taking are vitamins B, vitamin C, vitamin D, some hormones as well for the ones that I'm tested to be low in, bioactive lipids, NAD, and resveratrol. So these things are the things that help me because I'm not able to take all of these from my food, from my regular diet. And then fourth is the exercise and recovery. So this is also extremely important. In my biohacking journey, my goal was to become a better athlete. I was a keen athlete growing up, and when I started working, I have much less time to exercise and continue sports. So I took the opportunity to put myself in this biohacking journey so that I could get myself to exercise more as well. And with exercising, I think all of you know that you get sore or muscle aches, right? So a way that we use our clinic to help is I go through the lymphatic drainage. So that helps me get rid of the sore much faster, and then that means I can train again on the next day. At the peak, I'm not able to do that now, but I was able to consistently exercise 6 times a week, and I didn't feel sore or tired. Another tool that I used is the red light therapy and near-infrared light. It's known that the red light and the near-infrared light can give you photons, which when your body absorbs that in, can give you more energy. It helps you with energy in your mitochondria to produce more energy, as well as even collagen production. And another machine that I used is called Cell Gym, and that is the intermittent hypoxic training. What that means is I sit in a chair with a mask on, and that mask releases oxygen in a normal level for a period of time, and it switches to low oxygen level. And what that does is it mimics me training in a high altitude, as if I'm training on the mountains, where I'm just sitting on a chair for 70 minutes. So that's kind of a good thing, I suppose. And with that, it creates some stress on my mitochondria, which is responsible for producing energy in my cells. And when some mitochondria is stressed, the bad ones die out. And that encourages new ones to be reproduced and stronger ones to come out. So that's these are a couple ways that we use the resources that we have, or the easy tools, to help achieve more results with the same amount of effort. So apart from the 4 basics, I'll just go through just a couple of extra tips that I think it's quite easy for laymen like most of us here to pick up on. One is called the blue light blocking glasses. So everyone here uses a telephone, right? And our telephone emits blue lights. These yellow-looking glasses, you look like computer gamers. When you wear them, they help you block off these blue lights, which helps you be able to sleep better and block off these harmful light. Secondly, you can also turn on your phone to a night mode. When you do that at night, again, it helps you produce your melatonin better, and it reduces the harmful lights entering your eyes. You can wear an eye mask when you sleep. That's me talking about sleeping in a dark room, which could help you. If you don't have like really dark curtains, you can easily just buy an eye mask and put that on at night. Grounding. By grounding, I mean today we often stay in our office or stay indoors most of the time, and we don't spend much time in nature anymore. Grounding is basically taking off your shoes and walking on ground again. You know, we don't complete this circle of touching nature. So as the ground has negative electrons, right? So then when you walk on the ground, you complete that circle. It gets rid of a lot of the extra positive energy on your body. Stand-up desk. I know this is becoming more popular now at offices. Instead of sitting all day at your computer, you can also buy that stand-up desk and have more movement at your office. Cryotherapy, this is an interesting one, and I actually have not had the chance to do it myself yet. There's a shop that just opened in Gasorn Tower as well, but typically what happens is you get on this really, really cold chamber, almost negative 100 Celsius, and you stay there for less than 4 minutes and come out. And what that does is when you're in the cold chamber, your blood vessels get restricted, right? And when you come out and return to normal temperature, your blood vessels dilate again, and the blood rushes through different organs, and that allows the nutrition and the food to get into your cells better. And that's just one benefit. There are more as well. If you just Google cryotherapy, you'll find a lot of benefits about it. Many professional athletes in Europe are also using this therapy. Practicing mindfulness and gratitude, these are quite easy things for us to do. We just have to put our mind and our effort into that, because it's not just your body, but it should also be your mental wellness. So what's next for me? I started this journey, and I didn't tell you the full story yet, is because when I was young, I really loved to play sports. Basketball is my main sport, and I started working a lot, and during that time I had no chance to exercise anymore or play sports anymore. And I figured, well, if in this life there's ever a time to try to max out my potential and see how far I could go with sports, now is probably the time. I turned 31 this year, and if I don't try to do it now, it's probably just downhill from now. No offense to anybody. So that's part of the motivation that got me into doing biohacking, because I know I'm starting late. If I were to try to get into a professional basketball league now, I'm probably at least 5 years older than most people. So I need some extra help or some cheat codes. So that's what I'm doing. I did my test at Bangkok Hospital to get my preliminary, parameters. So all my jumping, all my muscles, flexibility, and all the tests that they do for the professional athletes. So that's the before. I haven't done the after yet. I'm going to keep going with my biohacking journey, and we'll see how it goes at the end. And then there were a couple of the interviews that I made on my biohacking journey, so that's going to keep me accountable, and there's no way of backing out right now. So hopefully you guys more or less learn about something, some easy tips you can do at home as well. And if you would like to follow the biohacking journey, you could also follow our social media on Misco on Health. Thank you.
Thank you, Mr. Varit. Our next topic is Integrative Medicine Approach in Wellness Management and Cannabis in Thai Traditional Medicine by Dr. Sulakkana Noiprasert, the Dean of School of Integrative Medicine from Mae Fah Luang University. Please welcome Dr. Sulakkana.
Hello. Thank you. It's my honor to be here and speak on the topic of integrative medicine at Mae Fah Luang University, Chiang Rai, Thailand. Firstly, I would like to introduce Mae Fah Luang Medical Center. It consists of medical center, hospital, dental clinic, wellness center, and Institute of Thai Chinese Medicine. This is the Institute of Thai Chinese Medicine. Okay. The vision of the institute is to integrate the traditional medicine and Western medicine and develop the standard treatment. We have 3 missions: integrative medicine, clinical service, and we are a source of practical training for the students, and we support for the research and academic service. Besides the medical service, we also provide the training and non-degree program training are available online and on-site. We have the aromatic massage course and health promotion in Chinese medicine course, herbal medicine, and acupuncture course provide on MOOC. And we have the program on-site like massage for health and wellness and Chinese herbal products, Lana Spa, and pediatric massage and integrative medicine for sport injury provide on-site. To develop the integrative medicine program, we have to a lot of study and research, and I would like to share you these 4 programs. The first program is the rehabilitation of post-stroke hemiplegia patients with integrative medicine. The second one is the treatment of office syndrome with integrative medicine. And the third one is acupuncture meditation program. And the last one is massage and cupping therapy for sport injury. In the rehabilitation of post-stroke hemiplegia patients, we combine the physical therapy and acupuncture and Thai massage in this program. According to the previous research, the acupuncture can dilate the blood vessel and can improve the cerebral blood flow and increase the oxygen to the brain. So we combine acupuncture with the physical therapy, which is the standard treatment for hemiplegia. The physical therapy is, can strengthen the muscle and can help the movement function. And the Thai massage can release the muscle, can relax the muscle, and can relieve the muscle pain. So we combine the 3 interventions in this program. And this program, we give the patient 2 sessions a week and 5 weeks for 1 course. So 1 course we almost give the treatment for 10 sessions. And we have assess the patient pre and post the program. This data we collect from the 16 patients in neurology department, and we found the parameter that we measure. The first one is the 10 meters walk test. It have improved 17%, and come up and go test has improved for 17%. Vital index has improved 51%, and sitting balance has improved 40%, and standing balance has improved 59%. The next program is treatment of office syndrome. We combine physical therapy and Thai massage and acupuncture and cupping therapy and stretching exercise in this program. According to the previous research, there is a good evidence that acupuncture is effective for relieve the neck pain and releasing the thought band in the cause of myofascial pain in office syndrome. So in the mild case of office syndrome, we combine physical therapy and Thai massage. And in the moderate and severe case of office syndrome, like they have the liver pain or have the numbness or have the limitation of neck movement. We combine physical therapy, Thai massage, and acupuncture and cupping therapy, and do the stretching exercise for the patients. This program we make the appointment 2 sessions a week and total 4 weeks. So after the treatment of this program, we measure the parameter of the pain score, muscle tension, and pressure pain threshold, and length of motion. The result of the treatment, we can see the pain score has improved for 62%, and the muscle tension has improved for 56%, and pressure pain threshold has improved 63%. Length of motion has improved 56%. The next program is acupuncture meditation program. This program was developed from my research. I have studied the effect of the acupuncture to the brain wave change in the healthy volunteer. My research found after acupuncture for 30 minutes, the alpha wave has increased significantly. You can see from 2.18 to 4.36, and have the significantly increase. So from this research, I applied acupuncture to treat the patient in the clinic. The alpha wave is represent the body is in the relaxation stage and have the brain activity become slower. So this wave has a good benefit for anxiety and stress control, and it may help anyone who begin to practice the mindfulness meditation. So during the acupuncture session, I usually ask the patient to take the deep breath and focus on the breath until finish the treatment. And I think this protocol maybe help the patient who have the psychosomatic problems. So this I would like to share you. The last program is the massage and cupping therapy for sport recovery. This program was developed from my research also. I studied the effect of cupping therapy and massage to the blood lactate in post-exercise. I recruit the professional football player, 15 persons in my research project, and divide into 3 groups. We have the cupping group, massage group, and rest group is as a control group. Is no intervention. And I induce the lactic acid by using 400 meters running with the maximum speed. After they finish the running, we check the blood lactate and give the treatment, massage and cupping therapy. And then we check blood lactate again on the after the treatment, 5 minutes, 10 minutes, and 20 minutes. And we can see the group of cupping and massage, the blood lactate is lower, significant difference with the control group. The blood lactate is the waste product after we exercise. If it can cause the muscle soreness, muscle pain, and cramping in the athletes. So in the case of like the athlete or the sport person, I suggest to use the massage and cupping after the exercise or after the training or after the competition. It maybe help to prevention of the muscle soreness and cramping in the athletes. Okay, the next topic is the cannabis used in Thai traditional medicine. This is the one of service that the hospital provide. As we know, the cannabis has two types, cannabis indica and cannabis sativa. The comparison between the two types of cannabis. Firstly, the morphology of cannabis indica has short, bushy plants with wide leaf, while cannabis sativa are tall and thin with narrow leaf. Secondly, for active compounds, cannabis indica contain higher CBD, while cannabis sativa contain higher THC. Lastly, the major qualities, cannabis indica is appropriate for use at night to promote mental relaxation, muscle relaxation, and appetite, while cannabis sativa is suggested to use at daytime to increase focus and creativity. In Thai traditional medicine has used cannabis in the formulas over 3 centuries. But in 1979, the United Nations categorized cannabis as a controlled substance. So after that, the Thai medicine decreased use the cannabis in the treated disease. Later in 2019, the Thai government issued the Narcotic Act No. 7, which contained important information regarding the importation of cannabis, permitted for the medical research and study. So in 2019, the 16 Thai traditional remedies that contain cannabis were announced and permitted to use in the hospital. And I would like to introduce the 5 remedies of the cannabis in Thai medicine formula. The first one is Tamlap Ya Suksayat. These remedies used to relieve the fluctuance, muscle pain, and stiff muscles that caused by epilepsy. That's used to promote the sleeping and appetite. The doses are available on powder and capsule. The second one is Thamlai Plasumane. Thamlai Plasumane is used to relieve the fluctuance and muscle pain and stiff muscles that caused by epilepsy and paralysis. The third one is Kae Lom Kae Sen, is the used to relieve aches and pains, and also hand and foot numbness. This the dosage form has powder and capsule. The next one is Ya Phai Avut. Ya Phai Avut can be used to relieve fluctuance and abdominal pain. And the last one is the Satnan Tripop. This is the oil. This one is used to treat the degenerative disease caused by fluctuance in the lower abdomen, resulting in severe stomach pain, spread to the top of the chest, and the inability to eat. Each remedy of the Thai medicine contain about 5 to 15% of the cannabis leaf, and the formula and the dosage we use according to the ancient record. And this data is collected from the Cannabis clinic that we provide from the we opened this clinic on in November 2021 until the April 2022. From 6 months of the service, we collect almost 100 cases. 54 cases is diagnosis of insomnia and 30 cases diagnosis of musculoskeletal pain and 16 cases diagnosis of migraine. And we measure the score. Like insomnia case, we measure with the Pittsburgh Sleep Quality Index. And musculoskeletal pain, we measure with the visual pain score. And migraine, we measure with migraine disability assessment test. We can see pre and post test at the 4 week of the treatment. The insomnia score have improved from 11 to 3. This is has improved. And musculoskeletal pain improved. The pain score improved from 5 to 2. And migraine, the score improved from 5 to 3 to 5 to 1 to 5. And there is no severe adverse effect found in this clinic. And about the contraindication in the Thai traditional medicine with cannabis use, we have to screening for the renal function test and the EKG. If the patient has the renal function insufficiency or impairment, they cannot receive the treatment with the cannabis in Thai medicine. So thank you very much for giving me opportunity to share.
Thank you very much, Dr. Sulakkana. At this time, we would like to take a short break. I'd like to remind everyone that we have our sponsors who have booths just outside this room. So we have a 20-minute break, and we'll resume again at 3:50. Thank you.
Visionary Healthcare.
back, everyone. We still have many interesting topics to look forward to this afternoon. Our next topic is Precise and Personalized Way of Treating Cancer by Dr. Bert Steffan, personalized cancer diagnostic scientist and CEO of Medivactum, here from Germany. Please welcome Dr. Steffan to the stage.
Thank you very much for this kind introduction and for the invitation to talk a little bit our work in Hamburg at our small family Medivactum. Me and my co-workers deal with cancer diagnostics in that way that we try to depict more or less the metabolic roadmap of a cancer, and from this analytical profile we try to derive a therapy proposal which will be submitted to the treating oncologist. We are located, as I told you, on the DAISY site in Hamburg. DAISY is one of the biggest German research facilities, and in former times it dealt with atomic bombs and theoretical physics. Now it is dealing with inflammation, and they try to depict or investigate the origin of inflammation, and this gives more or less a connection to our work, because, as I will tell you later, inflammation is one of the most important points in cancer development. Cancer is more or less a very individualized disease. In our work we saw that there are no two cancers existing with the same metabolic profile, and that means that also the treatment must be individualized. So. The other side. This sheet describes a little bit what we do. We have developed two test systems. The one is a so-called predictive test, and this predictive test diagnoses an impairment, a malfunction or illness at an early stage, and based on the results, a therapy proposal is submitted. The diagnostic system is generally applicable. We now also use it for successful diagnostics and for therapy suggestions for cardiovascular diseases, asthma, or rheumatism. The Medivactum tumor test pinpoints the Achilles heel of the tumor on a genomic, transcriptomic, proteomic, and metabolomic level. Besides, therapy proposal based on diagnostic is also engaged in the de novo synthesis of high purity substances for use as dietary supplements and immune stimulants. Recently we have established in Germany a network of radiologists, surgeons, oncologists, and neurologists for the realization of these therapy proposals. That's our playground. It's more or less a building containing of 4 or 5 floors. On the top, the genome, the transcriptome, proteome, and metabolome. I will mention it briefly because we saw, especially from our clients, we do not do any therapy, but under these life-threatening conditions, most patients go into the internet, into the websites, and they got a lot of information, some useful, but 80% not very useful, and they were bombarded with a lot of strange words. And therefore, I like to describe a little bit the background. In the past, people, especially scientists, thought that the genome and the metabolome is connected in a hierarchically way, and there is no way back. This is not true. Today we see that all these floors are more or less interconnected. The metabolome on the cellular level can influence transcriptome and back genome and so on. And you know this word epigenetics is in connection. This whole system is influenced mainly by the environment, by nutrition, by toxins, and by pathogens. And we have, with aid of our computer, we have connected more or less as a joke all the information we got from these different floors, and it produced a picture which looks somewhat confusing, but it mirrors more or less how a tumor is acting on its way. Normally, oncologists or doctors think we can eradicate a tumor like a bacterium. This is absolutely not true. If the bacterium is dead, then it's okay. But the tumor reacts every time on every type of treatment, and it is like playing chess with a tumor. It's sometimes an endless game, which need constant careful monitoring. The genome, for instance, you know it is located in the cell nucleus, but in this context, maybe this statement of one of the founders of this human genome project is of interest. He wrote, subject is himself, me himself, I'm in perfect health apart from well-controlled hypertension. The findings of the gene analysis are actually disastrous. His gene analysis. Almost 160 genes are conspicuously altered. Among other things, the risk profile includes 6 types of cancer, various autoimmune diseases, schizophrenia, bipolar depression, autism, obesity, blindness in old age, and a hereditary reading disability. The future, on the one side. But on the other side, he died age 95 without any disturbances, and that means this gene mutation analysis gives information about the weak point in the general construction plan. It must not break, it can break. And therefore, it is recommended to do very easily maybe changes in life, for instance, with natural products, and to help that it not break. The transcriptome is always in the internet. You will find this word also very often there. And it means it is more or less a copy of a standard operation procedure from the genome. The genome is more or less a construction plan. For instance, if you have a ship, there's a construction plan available. If a pump is failing, then the engineer will not take the whole construction plan, but it will look for the operation procedure for this special pump. And this is nothing else than copying these procedure, and nature makes it in that way. They call it transcriptome. That is more or less a copy. Very interesting is the proteome. Is very often mentioned in the literature. The proteome has some strange features. For instance, you can see here a so-called larvae, which by the time develops to this, crab. The genome is more or less identical. You cannot differentiate from the genome between both forms. But the proteome, as you can see, is very different. And that means that especially in cancer development and in cancer cure, not only the transcriptome, but also the proteome is very important. if you go one stair down to the cellular level, then you end in the so-called metabolome. It's the metabolism of the cell, and it comprises more or less so-called low molecular weight substances. For instance, urea cycles, citrate cycle, and so on, which more or less the power plant of the cell. And in former times, it was more or less impossible to analyze all these different molecules. For instance, for doctors, they look for creatine and maybe some other things. And today it is possible to have maybe in 1 hour a complete overview of the metabolome of the so-called cellular cycles, and you can analyze about 3,000 substances in a very short time. And this gives a lot of information. For instance, if an amino acid is missing, then you can conclude from this that the enzyme which produces it is failing. And maybe you can add it, or you can add the amino acid. How can tumors develop? Alexander von Humboldt wrote, "Life and the organic forces are incessantly striving to produce new forms." Yeah, unfortunately, sometimes in humans. And this is possible, among other things, through following tools: targeted mutation, random mutation, reading error. But maybe if you go, excuse me, if you go into the forest at a certain time, maybe in spring, you see a lot of these nice flowers. But if you have a deeper look inside this colony, you see some of these are changed the color from white to blue to purple. And if you inspect the same area, maybe 3-4 days later, you see a whole area is covered with this new form. And this resembles a little bit the development of cancer in this form through a mutation. In the human body, it's especially important, we call it silent inflammation. Nobody knows, you have no feeling that there is something wrong, but the silent inflammation is life-threatening or organ-threatening, and the body, as the general manager, tries to cope with this inflammation and not to leave the cell going into necrosis. Yeah, but the only way is, in that way, if there's no help from outside, you switch it into anti-apoptosis, and that means cancer. Unfortunately, there is no stop signal. A tumor does not need communication, cell to cell, cell to the center of the cell, but has a high energy demand. And the metabolism of a tumor cells is depicted here a little bit. Normally, people think glucose is the only way to feed a cancer cell. But if you stop the intake of glucose, then the cancer cell, as a very tricky organism, can activate so-called atavistic enzymes, and then he got his energy from amino acids, from serine, from glutamine, and pyruvate, for instance. And it is, unfortunately, therefore, it is not possible to starve a tumor giving up sugar. It is possible that you make his life a little bit harder, but he can survive. This is another way how tricky tumor cells are. They can create, indeed, new pathways for production of energy in tumors. For instance, they can use these amino acids ornithine and histidine, and he converts these amino acids to substances which are useful in the energy cycles. Maybe you know NADH and NADH plus and NR plus are more or less connected to the ATP-ADP energy cycle. And in that form, a tumor can get his energy production on its own way. This aldehyde dehydrogenase is a very bad guy. We saw, especially in cancer, stage 4, stage 5, that they produce a lot of aldehyde dehydrogenase, maybe for this reason. We saw on the other side that they do not need any milligram of sugar. They rely mostly on these amino acids and serine and so on. But this aldehyde dehydrogenase, as I told you, is a very bad guy because it is more or less connected to stemness. It's one of the most stem cell inducting factors in tumor angiogenesis, metastasis, chemoresistance, and immune editing. The solution of the problem, it is more or less 3 years ago, comes from the, or a first solution, comes from the working group of Elizabeth Patten, Imperial College in London. They could show that this aldehyde dehydrogenase can deactivate it through a well-known drug, nitrofuroxide. It's a pharmaceutical name. The name in the pharmacy is pentoforol, and it is well known as a drug against colitis. And there are some very interesting small clinical studies which show that these more or less old, very cheap drug can solve this problem with this aldehyde dehydrogenase. The tumor development of metastasis is more or less well known. We have a primary tumor, and this primary tumor sheds tumor cells because he likes to establish colonies all over the human body called metastasis. He sheds cells into the bloodstream called circulating tumor cells. About 99.5 of these circulating tumor cells were killed by the immune system. And therefore, the immune system is in cancer therapy or in prevention of cancer the most important part. By the time these, because they were hunted by the immune system, these circulating tumor cells leave the vessels, we call it extravasation, and go into the surrounding tissue. And like in espionage, they leave, they stand sometimes years in these, in the tissues, especially in the fatty tissue, like sleepers. And on a signal, nobody knows why, they go back to the circulation and at least establish in capillary system new tumors. Therefore, most of our work is performed with these circulating tumor cells. Diagnostic material is very easy. On the one side, we have tumor tissue. This is biopsy material. And we are looking for analyzing DNA and mRNA. On the other side, you have this blood sample and try to isolate these circulating tumor cells. No, that's but the isolation of circulating tumor cells is a big challenge, and it needs a lot of experience because you have only 5 to 100 CTCs in 1 milliliter of blood. And on the other side, you have around 5 billion erythrocytes. That means if 5 million people shout A and you have only 100 shout B, you have to select the right group. And therefore, it is very challenging, and it needs a lot of experience not to end up with this friendly guy. At least gives our system information about the tumor's metabolism, his messaging system. A tumor behaves like a little state, like a little country, or a little town, or sometimes a big town. It gives information about the metabolism, the messaging system, the methods of meeting its energy needs, its aggressiveness, its resistance mechanism, and its plans for the future. What is the rationale behind an individualized integrated tumor therapy? We are looking for so-called gene expression. That means that we look for the production of certain proteins in that way for so-called receptors. Receptors are located on the outside of the cell, on the surface of the cell, and they manage the messaging system. And for instance, if we see in our analysis that EGFR, this is one of these telephone knots, is highly expressed, the logic behind is we have to inhibit it. And this is, 0? Oh. Yeah, maybe this one, no? Or is it okay? Huh? Okay. The rationale behind is indeed you try to block this receptor. You can do it with pharmaceuticals, you can do it with cetuximab or so on, but you can do it also in a modulating way with natural products, especially, for instance, with vitamin C, vitamin D, or on a way directly to the cell center with apigenin. You can block, for instance, STAT. And this gives the information. You can block it on the one side totally with these drugs, but on the other side you can modulize it with natural products. But the difference is more or less natural products can only modulate. It is like switch increasing or decreasing the loudness. But it does not work, especially if the tumor is very aggressive, then the tumor will win the race. Yeah, done. Okay.
Thank you, Dr. Steffan. Is this yours? Okay. Our next topic is Enhancing Athletic Performance with Immunonutrition by Ms. Alisa Nana, clinical and sport dietitian from Bangkok, Thailand. Please welcome Ms. Alisa Nana to the stage.
Hello. Hi. Hi, my name is Alisa. By trade, I am a sports dietitian, and so I'll be giving you a topic that's probably not your main area or your main interest, but just something a little bit different, I guess, to spice your Friday afternoon. And so my trade is I am a sports dietitian, although I am mainly, maybe I'll take my mask off so people can actually understand my poor accent. So mainly I teach at the moment at a university, Mahidol University, but obviously my passion lies in being a sports dietitian to a team. And so today, because with the very limited time, I'll only be introducing to some of the, I guess, key topics or key current interests, especially in the field of immunity in athletes. And hopefully you maybe can apply it to your clients or your interested clientele, for example. But like I said, because we have very limited time, it's only a short snippets of what we're going to talk today. So currently, if you're not Thai, you might not know this. We are having a sports competition in Vietnam, so Southeast Asian Games. And so that's been going on. It will finish this weekend. And so leading up to the event, all the athletes and the teams are very concerned about not getting sick. And there's been a lot of literature showing that the most successful team are the ones that have least injuries and least illness, and that's pretty obvious. And so athletes, I guess, they don't want to get sick, whatever way, but unfortunately they are at risk of getting sick for many reasons, as you can show here, as you can see here. And so what we try to do is obviously try to not boost their immune systems and making sure that their immune system is maximized. And so what are some of the, at least my interest, what are some of the key factors that I look into trying to reduce the occurrence of illness is, number one, if you're not familiar in the nutrition field, it's a term called low energy availability. And so when an athlete, something along the line of there's a mismatch between an intake and a usage. There is little, so not enough energy is left over to fuel the body pretty much. And that's a very common condition seen in athletes, especially in endurance athletes, and so we try to reduce that. And that can lead to having a very low energy for, usually chronically, for a long period of time, can lead to a syndrome called RDES, or Relative Energy Deficiency in Sports. And that's, traditionally it's known as female athlete triad. So you see female athletes having amenorrhea, low bone mass, and potentially very low energy. But these days, they've become a bigger syndrome. So I'll show you in a minute what it is. And thirdly, a lot of athletes obviously going through stress. So whether that's competition, breakups and school and things like that, or stress from traveling, or stress from a lot of training can have an impact too. So those are the three things that I usually try to minimize to make sure that immunity is well preserved. And so this is, I guess, the diagram trying to depict or explain what is RDES. And so what happened is the cause or the root cause of all of this is the lack of energy. So like I said, there's a mismatch of energy. And what happens is that the body doesn't get enough energy to do all the normal things the body should be doing. And so what happens, so traditionally, like I said, you get the female athlete triad, like in the diagram, that's traditionally. But these days, it doesn't just restrict to the females. The males, the men have it too. Okay, and so what you get an impairment of pretty much your whole body. And so you'll get a variety of symptoms. What I usually see is the female is the obvious one, so they don't have their periods. And when you do a DEXA scan on their bone, it can be low. What else do I see? A lot of injuries. So common injuries that they get, and they don't heal properly. It takes a long time to heal, and it's a recurring injury. So that's one of the warning signs. The other one is that when they train, they don't get the adaptation that we want. So they train hard, we expect their performance to go up, but it didn't. So those are the key symptoms that you see, but obviously it's very hard sometimes to detect. You think maybe it's a training, maybe it's something else, and it's probably more the doctors in the sports medicine area that might presume that maybe the root cause is lying in the energy. So that's one of the things that I usually target. And so as a dietitian, these are the two main key points for the athletes that I try to emphasize all the time. Number one is obviously to avoid the low energy availability. And so that's, for me, most of the time is making sure they eat enough, especially in the endurance athletes, because they really want to be lean for their competition. And so they intentionally eat less while they train for 6 hours a day. And obviously there's a big mismatch, and that's they will have an impact on their body. And so the other key message is to focus on recovery. So recovery nutrition is a big issue too that we want to do. There's this concept called 4 R's of recovery: refuel, rehydrate, revitalize, and repair. So these I try to make sure that they eat enough, pretty much, with all the right nutrients to help reduce RDES. The other questions that I get asked a lot is obviously, are there any supplements that would help? This is the diagram more recently trying to explain the immunity point of view in terms of what we can do nutritionally to maximize the immune response. So on the left, in terms of resistance immunity, there's not much that we can do. Like I said, the risk factors for reducing resistance immunity is the energy. So if you don't eat enough, then your resistance immunity will go down. What we want to focus is potentially on the right, what is called tolerance immunity. And so you might still get sick. The point is you might still get sick for an athlete, but if you can potentially boost your tolerance immunity, maybe you can reduce the severity or the burden of your sickness. And potentially this is where all the, I guess, the research is coming in, at least for the athlete's point of view. Okay, so I'm just taking some of the examples from the review paper that this is from. And so at the top, I'm just only referring, for example, for the immune-resistant immunity. So at least from this review, what they suggest is most of the nutrients there, obviously with the cross, there's not a lot of evidence to support or to boost your immune resistance. However, zinc is one of those that actually used a lot in athletes when they're already sick. So when they have a cold, they get sore throat, if you give them zinc lozenges quickly, it can help reduce the symptoms. And that's used quite a lot in sports already. What about tolerance immunity? This is looking a little bit better. And so those with the green ticks, so the probiotics, vitamin C and vitamin D are the ones that have a lot of evidence to support the use, whereas the antioxidants or the omega-3s aren't so much there, unfortunately, for the athletes. And so I think everyone's probably well aware of the importance of probiotics these days, especially for your immunity. The same story goes for the athletes. And so there are becoming more and more evidence to support the use of probiotics, as there is a huge relationship with exercising and with health and everything like that. And so just a reminder, because I am a dietitian, of course I have to talk about food. And so I always explain to people, you know, what's probiotics and what's prebiotics. If you used to play Pac-Man like I did when I was a kid, you would understand this a little bit better. So probiotics are the foods that contain the live ingredients. So depending on where you're from, the foods will be different. I guess, you know, your daily probiotics intake will be different because we eat different food. And you can see from the list there, how much time left over? Oh, my hand. So, and also the prebiotic is the food for the bacteria. Okay, so they look like a long list, a very complicated list. For me, it just means that you need to eat your fruit and vegetables to support your gut bacteria. That's the conclusion. Okay, so what I usually say to the athletes, people, well, especially Thai people, we don't eat enough fruit and vegetables. And what I try to tell the athletes that you need them, I mean, for recovery and for the vitamins, for the immunity, that's one reason. The other reason is to feed your probiotics in your stomach. And so you need, yes, you can eat your yogurt, but you need to eat your vegetables as well. And that's, it's a common sense kind of thing, but there's scientific evidence to back it up. And so, yeah, you need both, not just the supplements will not work on its own. What about probiotics? Does it work in athletes? And what are some of the current recommendations? if we look at the data, like I said, there is pretty moderate to strong evidence to support the use of probiotics. Usually, it depends on where you're from and the policy of each country. Sometimes it's used 2 weeks before going to a big event. Sometimes it's used throughout the athletic lifestyle, depending on what you aim at. Some people use it to reduce their irritable bowel syndrome kind of symptoms. So people with, sometimes diarrhea, sometimes constipation, you can try probiotics to reduce it. Or, like I said, leading up to a big event to try to reduce the potential risk factors for getting sick. So, you would try to use it 2 weeks before going to an event. And so this is, one of the main supplements that is obviously currently being used in sports as well. The other one is vitamin D. Obviously, everyone knows about vitamin D already, especially in terms of the calcium metabolism. But the same thing, we know that it's really good for the immune system, and we take that advantage for the athletes as well. So what's the function of vitamin D that we use a lot, or we try to support the athletes, is related to the muscular function. And again, there is more and more emerging evidence to suggest that vitamin D is very important for muscular function. So for muscle rebuilding and repairing, as well as muscular function of the heart, for the immunity, obviously. And so it makes sense that, it's suggested that vitamin D is very important, not only for the normal general population, but for the athletic population as well. And that's the current evidence, or the current suggestion, is that we try to avoid sub-vitamin D in any athletes. And that's the bottom line. And so depending on where you live, in Thailand, you would think, this is not a problem at all, because it's a very sunny country. You're wrong. I work in elite athletes population in Thailand, and we have tested athletes such as taekwondo athletes. So we're talking Thai national athletes, taekwondo and volleyball, and most, I would say almost 100% are vitamin D deficient. Okay, so it is a big problem because we are city people, and most Asian people are afraid of the sun. And so also these athletes train indoors, and so they have very little outdoor time. Although they try to do their, warm up and their like short runs outside, you still see, I see pictures of athletes doing their stretches outside, but not directly in the sun, right? Because they're still trying to avoid the sun. So it is a problem. So in Thailand, we have a problem with vitamin D deficiency, especially if you live in the city and you're a female. That seems to be the risk factors. And that also applies to our athletes. So we try to avoid that. So obviously, we usually refer to an endocrinologist to get it sorted out and supplement accordingly. And so we also supplement oral vitamin D. We don't really do it in Thailand in terms of IV, but I know in Australia that they do. So it would just depend. And obviously sensible sun exposure. It's very hard to tell Thai athletes to go into the sun. You probably don't understand what I'm trying to say, but yeah, it is a big problem because they won't do it. So I'm just wrapping up really quickly. And so the key message for the athletes is, number one is the energy. A short period of time, if you're looking at a weight-making athletes, they have to go into an energy deficit to lose weight. We understand that. But if they're in energy deficit or that low energy availability for a long time, they will get that syndrome called RDES, and that is a huge problem. Similarly, carbohydrate is, I'm coming again from a study is looking from the athletic point of view. Ketogenic diet is very popular, especially in Thailand. Athletes want to try it for whatever reasons. There is evidence now coming up to say that if someone is on a ketogenic, even for a short period of time, their immune response is dampened. So they tend to get sick more. And so again, coming back to a concept of recovery nutrition. And so we really emphasize on carbohydrate. It's not only for the energy, but it's also for the immune system. And there's a lot of evidence to support the importance of carbohydrate, that it's more than just energy. Micronutrients, like I just mentioned already, vitamin D or probiotics, or even we can go on and on. There's actually other micronutrients that are important too, such as iron and things like that. For example, Thai people are have a higher rate of thalassemia or thalassemia traits, and so they tend to have iron deficiency or very low in iron already. Again, we see a lot in athletes as well, and that we try to avoid that. And the last thing is sleep. Again, sleep is part of a recovery process. And for me, even athletes trying to lose weight, they don't eat carbohydrate. Again, there's evidence to show that quality of sleep is less. And so we try to fix that problem. And again, there's also ways in terms of nutrition, energy, nutrients, to try to support or to promote sleep as well. And that's the end. Time's up. I'm sorry I have to finish. I went very quickly.
Thank you, Alisa. So we have some time. The other room's not finished yet, so if anyone wants to switch rooms or go for a little break. next topic is Mind and Energy Medicine by Dr. Nalinee Sutthipisal, dermatologist, anti-aging and regenerative medicine specialist, practicing energy medicine in Bangkok. Please welcome Dr. Nalinee to the stage.
Yeah, it's my great pleasure today to sharing with you my experience as dermatologist and becoming dermatologist in combination with energy and the mind. So, how can I? Thank you. It doesn't work. How come? So, I need my help. Actually, yeah. Okay. Which one? This one? Down. Okay. So I'm just start with something about the energy, and I think all of us here in the room is exposed to energy, because we have energy to make us live and living, and energy heals energy. So in Greeks, energies mean action, activity, and operations, and medicines mean healing arts or remedies. Sorry. Actually, it's years, thousand, and more than thousands years ago that we human being exposed to energy healings. But some is come up to nowadays by the National Center for Complementary and Alternative Medicine. There has a new field of modern medicine of energy. One group is about the one that is measured scientifically, and such as electromagnetic therapy. So I'm going to share with all of you today about my experience about that, and some kind of measurement sound wave. By the way, there are nothing that is subtle energy that is not measurement yet. So such as energy healings, acupuncture, qigong, ayurveda, homeopathy, therapeutic touch, reiki, or even distant healing. That in our group we do all that, some of that things as well. So we can just share with you a little bit of that. So we combine. It's something that I cannot move it. Where to put it? Maybe this one. Okay, now I know how to use it. So the energy give life to the body is activating healing energies and also restoring energy that weak or disturbed. So energy heals and energy system are healed. Albert Einstein, everybody know, he once talked that future medicine will be the medicine of frequency. Is anybody in the room listen to another room about the ice and the cold? I just talked with the speakers. I had just broken my fingers three weeks ago by falling accident. And then I don't listen to this lecture before, so just go back. So sorry for that. But also Annika, Montana, right away, and I used the frequency medicine. And when I came to orthopedics, he said that, how come that you have no swelling and you have no bruise at all, but you have broken bone? And I X-ray and it's better, but anyway, have to go on for a few weeks. So that is energy frequency that I can share with you today. Okay. So actually, energy medicine can be in diagnostic part, and as we have like EEG, EKG, MRI or something, and also we can use it in therapeutic part. But we know less about that, or we pay less attention in conventional medicine. So it's in peer review that every organ system has its vibrational frequencies that control it, vibrate with it. And also one system organ can have many frequencies, and even one frequency can regulate or can resonance with many organ systems as well. So it's all working together. Many peers review about that, like 100,000, 500,000. When we use the medicine, supplement, drugs, hormones, we need to have receptor to get the enzyme that is very locked in. But when we use frequency, resonate, it's just the one that we go on and it can touch and resonate and go without any receptor. It can activate and restoring energies of energy healings. So the action is that the pulse electromagnetic field therapy can open to vitamin, mineral, and oxygen, and also help to expel waste product that is make us healthier, longer living, and vital life. And if you can see the live blood, live blood analysis. So the blood flow is much better. So the energy gives us the like kind of battery to live. And that is very good. If we can use it alone, or we can use it in combination with many conventional modalities. And sometimes we use it in energy, productivity, in stress and anxiety, depression, sleep, wellness, aging, and sports. That's why it helped my broken bone too. I thanks Rolf Binder, who is innovate, because there are so many PEMF. If you'd heard that, PEMF come from the word pulse electromagnetic field therapy. But so many, but how can we have the innovation? The experience that I use is this device, and it personalized biofeedback, focused tissue stimulations. I can tell you what is that. In this is the device that has 4 modules. Module number 1 is related to organs and emotions. Module 2 is related to organ system. The organ work in the system cannot work it alone. In order to have like good heart, you have to have good kidney, good autonomic nervous system, and many, many good things working together. And we have plus, I tell you later. And module 3 is microbial related frequency. And module 4 is nutrition assimilation for vitamin, mineral supplement, and even heavy metals. The work is impacting on nervous system, immune response, lymphatic flow, and metabolic functions. So it can have therapeutic solution for inflammation, infectious process, scar, even emotional scar, hidden scar, or the real physical scar, and shock and trauma. I'll just give you some example of the case that I'm come across with. Common things, headache. I have 3 patients to demonstrate. Patient number 1 has emotional stress and come with the dizziness. Patient number 2 has been filler 3 cc in the forehead in one of the international meeting by the Korean doctors. They have throbbing pain up to number score 8. And number 3 is the patient from the ICU, had headache for 3 days, take Panadols, paracetamol. The headache is partially controlled, but they're still giving with no reason. So what is the cause? So they asked me to go and check them. And with these things, as I told you, module 1, emotional, module 2, organs function, module 3, for vitamin supplement. Number 1, we give them about the emotion and joy of life. Joy of life has it. And make her better with the assimilation of CoQ10. The pain score from 7 to 3. Number 2 has band A, is mean that acute lesions on the head and also the stress. You see, injection 3 cc in the forehead without having breakfast. What happened to the patients? That throbbing 8. When the patient has throbbing pain, number score 8, the doctor feel like it could be complication or filler complication, go to the blood vessels and go to the brain. That is the big things. So when we can reduce pain, that the patient has paracetamol for 3 hours, doesn't improve. And then we give her the device, the frequency medicine. It can reduce from 8 to 1. That make both the patient and the doctor so happy, because we make sure that there's no complication from injection. Number 3, we come across with interference from electromagnetic pollution. Yes, in ICU there has a lot of monitoring in the body, right? And also they stay in the ICU for 1 month more than that has muscle nerve pain is very common. And in the processed head area, we find out vitamin B1 assimilation. Vitamin B1 point is here on the middle of the scalp to the right. So that is, we can make her pain score from 5 to 0. That is because we get to the point. So with the device, we can treat the pain according to the root of cause and electromagnetic pollution. We can cope up with that. Now come to the low back pain. For patients, all with low back pain. You see, the patient has the same symptom. Sorry. I think it's not sensitive. It's the battery or something. Okay, at the end of the day, maybe. Thank you for all your be with me. So they have the same symptom, but they have different causes. But we have personalized treatment because we treatment according to the root of the cause. Patient number 1, emotions. They have very stressed, and this vitamin supplement, mineral supplement is magnesium. Where patient has a very much stress, magnesium, the pain score reduce a lot. Number 2 of the patients that stress and acute pain and assimilation with CoQ10, the pain score reduced. And number 3, see, there has adrenal insufficiency that we all know about that when we work so hard. And see, the comparison is that with the people that has less energy of living, the pain score different is better, patient feel better, but the difference is not that much as the stress that is very much stress, active stress. And we can cope up with the emotions, stress as well. So all the patient need to follow up and repeat the therapy because it can help people better and better. If you want to do the action of the pain, is calcium combined with calmodulin to be calmodulin calcium complex react with the endothelial nitric oxide synthase to have nitric oxide that has the action of anti-inflammatory, pain, edema decrease. See, the action is in the second or minutes. It's not have to be long. So I'm doing a lot of post-operative care with the device, and the patient, when I'm dermatologist, when I'm doing some laser, ablative laser, I said, my patient going out of the hospital have to be pain score 0 before leaving, and that is the must. So the action is so fast, and they can even make a growth factor as well. So the energy medicine can treat the illness, relieve the pain, immune function, stress relief, improve memory, enhance digestion, and cope up with all the electromagnetic pollutions. This is interesting case. I learned something from such a case. The patient has usually is a marathon running hobbies, and they have pain. She has pain on the calf for 2 weeks. All rehabilitation treatment. Actually, she is the rehab doctor herself. So she do, and we see the bruise on her leg by the shock wave or some other things as well. And when we find out with the device, the emotion is about the bladder so irritated. The modus 2, instead of muscle pain or something, we find kidney bladder system. Module 3 organisms, we find the Proteus mirabilis. And the module 4 of the nutrition assimilation, we find protein. How come with the patient with the calf pain for 2 weeks? So, and then the teacher in our class said, treat as you find. So we teach them all the kidney things. And the pain's gone immediately in the room to 0. And I asked her 2 weeks after, still 0. And I asked at that time, do you have anything about the kidney or cystitis or something? And the patient said, no. Until time passed by. And then she recognized that 10 years ago, when she helped her mom admission in the hospital 10 years ago, she has a bloody urine. She never has such an symptom again. But this is because we can find a hidden emotional trauma. So we treat at the root of the cause, so it's very specifically to her. With my MD as experience for years, I cannot think about that if I haven't had a device to tell me something, and I've learned from that. Actually, I learned a lot from the device that I use it for more than 10 years, so some experience. And with the Alfred Pichingers, he said origin of the disease is first signal register in the connective tissue. With the ornament that has the handheld, it is little hand. If you can go and you can try it, it scans the whole body. One thing when it resonates a lot, and you can find the root cause. And when you biofeedback to treat the root cause, and then it can spread to all the matrix of the body to the whole body. So you use very little energy, find the root cause, treat exactly the primary problem. So I have to have double time for the slide. The thing is, so actually with the energy medicine, I would like to share with you because I learned this. There hasn't had to be a big energy. You have very low intensity of the energy because it's like a nuclear. You can go, if you have the weak energy but the right frequency and resonate with the right place, right site and right problem, you can cope up with it because you can have the energy that align with the nature is good enough. You don't have to have any strong thing. With the device, I haven't used that much, but some doctors use. There has a protocol for many things, for anti-aging, cardiovascular, sleep, or other thing of skin. But I love, as a dermatologist, sometimes I use this thing, but I use for this. I use for the sugar. When I have a patient that has a lot of pimples, I use sugar addiction. They come 2 times and they can stop eating sugar. Otherwise, they cannot use their brain to stop it because the patient feels that the food is less sweet. After 2 times, it's very quick. So this is I use, and I know 99% effectiveness is 100% as my experience. In summary, see, when we have the handheld and we can do specifically, we can use low intensity with the handheld focus mode. That is the only thing that has focus mode, tissue stimulation, that can help to find and treat the root of the cause. And also with the low intensity, it's so safe to treat the patient because even the patient has pacemaker or metal implant, it doesn't matter, it works. Because the intensity from the device is less than the pacemaker itself. And with the wide range of frequency, you can treat many, many conditions from head to toe in every system. And we have individually, as you can see that, different patients, different problems, different things, we can have it by palpation of the pulse. Can be used alone or in conjunction, adjunctive therapy with the conventional modalities, non-invasive. When you go and the energy here, you're going to feel a little bit sleepy. And actually, if anybody in the room that come across with the energy medicine, with anything, because all the energy, when patients get the healing by the energy resonate, they're going to feel a little bit sleepy. No matter you treat mentality or body or physical function or any modalities of the energy medicine. And of course, we use it a lot in this COVID era. I once talked about the COVID that we use it with the, we use it with the COVID infections, long-term COVID vaccine side effect. From October the year before last, I have only 7 patients that don't need this. And actually, we all in the room, 90% of us need it if we vaccine, because it's not as healthy as before. So the device can cope up with that in 1 to 4 times visit. So can help the post-vaccine problem and make us healthier. And also any other difficult to treat. And even if the patient has variant mutation of the COVID, because of the frequency of the microorganism is fixed, and then even they deviate like 0.1, 0.2, 0.3 frequency number, don't worry because we just palpate. Anything that resonates, treat that. So we don't mind about mutation as well. Okay, I just passed that. I mean that the slide before here is that no matter what organ system are, they can help you. I think the battery of something. Okay, no matter it's cardiovascular, vascular, GI, kidney, lung, brain, or anything, it can cope up with that, with all the autoimmune problem. I'm very lucky that I get from inventor of the device give me the protocol for treating COVID and post-vaccine. That I use it for more than a year. For the COVID, there has protocol for patients that can improve the immunity against the COVID and also can use for pre-vaccine. So I use it the era when they have no vaccine in Thailand yet. If you can find out a little bit inside, you can see that different programs can help, like the neck, the autonomic nervous system, and the immunes. Or otherwise, it's psychoautonomic nervous system, immune, and inflammation of neck. Or otherwise, it can be brain, lung, detox, or liver, kidney, and the immune, and also the brain. With the post-vaccine, we see that people has a lot of problem. You can see that the immunities and the lungs and the brain, the kidney, the bladders, and the stomach and the neuro, the brain. Brain is a common things, and cardio is a common things in post-vaccine. We would like to have the sustainable treatment solution with no side effect and can treat the root of the cause. So that we can reduce the need for opioids, hypnotic and anti-inflammatory, antihistamine and anticoagulant or other drugs. So this might be one of the solutions for us. Actually, I feel like the ornament is state of the art of the device, that the brilliant of the one who invent, that the body can respond to stress and improve the immune. Anybody know James Oshman? Thumb up. How come? We start late, is it? Can I have a little bit more? Because I haven't started mine yet. At least I'm the last one. Don't worry, if any of you would like to go out of the room, please. But I just would like to go in quick, because I think mine is something that about the energy as well. And James Ottman said that when we leave energy medicine out of our biomedicine, we waste a large amount of healing potentials. I think I might have somebody to help me going on the slide. It doesn't work. I'll go to mind. For the mind, when we, of course, we would like to have relaxation more than stress. Our life is so stressful, we cannot sleep, it reduces the immune, and we have the sickness. When we can be relaxed, we can be better health and happiness. I cannot. Bruce Lipton. Help me, at the back, help me, because it go without. Okay, thank you. Better, faster. With the Bruce Lipton's biology of belief, mind control the bodily functions that we see how it work. Okay, come on, please. Bruce Lipton said the mind has two parts, consciousness 5%, subconsciousness 95%. If we want, thought is in the conscious, so we can go for awareness or creative. Subconscious 95% is the record, habit, and behavior. Consciousness, when we perceive something, our neurology perceive it in 1 out of 10 seconds, faster than you blink. But in the subconscious, 10 out of billion seconds. How come? Our body perceives subconscious 10 out of billion seconds. No, there's no time in subconscious. We get it at all time. That sometimes makes us sick. If we can cope up with consciousness and both subconsciousness, we can help a lot of patient healings. Next, please. Thank you so much. So we have the belief create thought create action create habit, and habit create the behavior. But we have to have right belief. What is right belief? Come on. Right belief can change your life. Right belief can overcome repetitive, destructive thinking. So it can help you about the physical breakdown and emotional suffering. Minding the body, mending the mind is all important. Please. If we would like to have effective healings, we should have good intention and good belief. Next, please. If we go to the placebo effect, there has people that have a list of thought, and also the thought that they go to the gym, and another group is going to gym themselves. This is very good represent the placebo effect, because the placebo effect is 1/3 of the people in this group. How can we have placebo effect? Because they have good intention. They focus what they go to the gym, how it look like, how is they acting, and with that, they engage in. They can have information, follow the intention. In order to practice intention, it's good to do meditation and open mind. So give a tip and tools to do that too. Next, please. So if we talk about belief, thought, emotion, that look, my intention, belief, influence, healings. Would like to have incurable or curable? Of course, we would like to have curable, but we have to send in the intention and belief. Next, please. See, if you are said incurable, you are incurable. If you think that you are curable, you are curable. But sometimes you would like to have curable, but you don't even know that. My experience, the difficult patient, the most difficult patient is the doctors, the practitioner themselves. They think that they have a very good doctor, very good drug to help them, such as cancer patient, but they don't know that their subconscious keep on what they have in experience. For example, the C patients. Patient come with the cancer, one side, and then to another side, get surgery, get chemotherapy, get radiation, and then metastasis and death. They collect that things in their subconsciousness. So if you want to have the curable things, subconsciousness should be incongruent with the conscious mind. How come? That is a trick to help such a patient, but they have to have right belief. Next, please. With the emotion, the tip is that if you have a negative thought, angry, frustration, the healing cannot be good. But easy to talk, difficult to do, but you have to practice to have realization and acceptance. That is, once we have emotional shift from frustration to joy, our body physiology changing, biology change 1,400 in order to change only frustration to joy. So if we can think about how many emotions create a lot of change in one day, please. So I just suggest we should have emotion diet. Have we today? To have love, care, appreciation that make us regenerations. But if we have negative, of course, degeneration. We nearly finished. Masaru Emoto, I met him once. We go together to make the canals clean together with the meditation too. And he once talked about the memory of water. Look at this. If you have a bad word, bad thought, memory water is not as good as the good words. Prayer, thank you, love and appreciation is a very nice crystal. Please. Our body is 70% water. Our thoughts and our words affect the water crystal in the body. So if we have a good water crystal, our organ will function very, very well. So that is the key point. We know that 7 extensions of life: to eat or not eat, to drink or not eat, to sleep or good. The trick is that even we make food, we go to the very good chef. But see, the chef, very good chef, usually they have intention that by the success. And if sometimes I go to the course that I pray when making salad or something, it's so delicious. It's not only the recipe, but it's the mind of the one who cook and the one who eat as well. They eat with pleasure. So it's many things that we involve in life. And when I'm doing something, this is all things, but nowadays, anybody here has no cell phone? Please raise your hand. So now we are in the electromagnetic pollutions. It's not only the cell phone, it's Wi-Fi, router, our work, or even the post. So we have to have something new in order to cope with that as well, and our right thought and right belief. Please. Neurobiologically, our minds control our genetics and behavior. We talk about the genetics in these meetings and how come the mind control it. Come on. Look at this family. You think they have a good health? At present, maybe this boy, because he's young. If they grow up tomorrow, next month, next year, he might be like this in the future. Because this is the epigenetic environment, the way of thought, the way of eat, the way of doing something. So I don't surprise if the family has next please, the genetics of cancer. Because we can see the literature that even adopted child in a cancer family can have cancer as well, right? So this is very important slide for me to create this. I think the mind. When we'd like to cope up with people, there has 3 sections of the mind of the patient, the mind of family, and the mind of healers and practitioners. For the minds of the patient, they should have positive thinking, right thought, and right belief. But anyway, this positive thinking, right thought, and right belief should be the property. I mean, the family should have this as well. The healers and practitioners should have this as well. So then my family support should have this in combination, but how we can help the patient or our loved one to have reason to live, worth of living, and express love and care. See, I see a lot of patients, and I think the family support to have their love and care. How to do that? How to do? If the family hug the sick patient every day, talk about the nice thing, tell them what to go. Like now I have mom. My mom age is 91, so I just tell her, we should be strong. Her purpose, her value is to travel for sightseeing. We should have some reason for them to have, to make them help well. And please just go back, that is very important slide. And our practitioner should have besides all these things, they should have compassionate, good intention, touching lives with caring hands by heart. I mean, that's why, how can we do that nearly the last? Yes, please. Next, please. Thank you. How to do this? I would like to show you something. Come on. Me, myself. Next, please. Next. Doesn't work. Mine doesn't work. You go to next slide. I'm going to finish with the last slide. Okay. This is very important to feel. Why I talk about the mind? The feel that we are this field. We are all connected. Even I'm talking now, there has some resonate with the energy, like my mind talking. So when you listen to the speaker, it's good to be in the room more than the video or something, because it's live, and the energy can express and the energy can transfer. When I would like to go and visit my patient that admitted, what I do is that I don't visit about like hospital visit, but it means I have intention to go to help them. So, and even I tell my patients, my family of the patient, that if the patient is at the end stage of life, you don't so sad, because your sadness doesn't help any patient. You would like them to live it good at the end of life, so you should prepare yourself before visiting them. So I mean that is the feel, because everybody can feel the feel. And even we can have teletransfer of the energy by the field as well, that why we can have teletreatment. So energy is, we are in the same field. Yes, please. We connect. Please, next, finish. Yeah, this is my last, nearly last. Information, medicine, everything is about information, please. If I can go fast, I can make it myself, but I can't. To be honest, I feel like years of working, the enzyme, the hormones, the medicine, the supplement, the drugs, is good because I use it. But I think it should be plus. So plus is not enough for our general health well-being. We should have something. Please, next. Please. Yes, I work also, besides the hospital, I work also in my clinic. And our clinic, besides using all the energy device things, we pay attention more in emotion and thought and belief as well. So we have many things to cope up with the emotions or health. Conscious, subconscious, mind-body connection. We go to the subconscious. Emotional erase, the ornament, the frequency divider, and share with experience. Emotional code, we do it. Osteopathy, sane, homeopathy, and Bach flower. Please, we finish. Yes, just go on quick. Yes, we pay attention in body, mind, soul, and spirit. Sorry. If I'm just, I can't. Finish. Right belief is a strong medicines, and the future medicine can be energy medicine really become mainstream is by the president of AFM, Dr. Ronald Klaas. But I just share with you and I just encourage all of us to have at least start with the energy of good energy, good belief, right belief like now. And we can introduce such a things to our beloved patients and families. And if we go for the frequency medicine, I think it really go for the mainstream. But I love it. Thank you so much. And everybody listen to me. So sorry, but I cannot make a quick click. Thank you.
Thank you, Dr. Nalinee. We've reached the end of our afternoon sessions. We don't have time for a break, so I'd like to invite everyone to the ballroom for our closing remarks. And then cocktail reception.